Here is the male reproductive system anatomy. The penis is the external male genitalia. The urethra is a duct by which semen is conveyed out of the body and which also conveys urine from the bladder, but not at the same time. A testis is an organ that produces spermatozoa. Plural, it is testes or testicles. Scrotum is the external sac that encloses, protects, and supports the testes. The vas deferens is the duct that conveys sperm from the testicle to the urethra. The prostate gland lies under the bladder and surrounds the upper part of the urethra.
Impotence, erectile dysfunction. Phimosis, narrowing of the opening of the foreskin so it cannot be retracted to expose the gland's penis. Anorchism, a congenital absence of one or both of the testicles. Cryptorchidism, or undescended testes. Epididymitis, inflammation of the epididymis. Hydrocele, a hernia filled with fluid in the testicles or the tubes leading from the testicles. Varicocele, of varicose veins of the testicles. Testitis or orchitis, inflammation of one or both of the testicles. Azoospermia, the absence of the sperm in the semen. Oligospermia, low sperm count, benign prostatic hypertrophy, or enlarged prostate. Prostate cancer, one of the most common cancers in men that may grow slowly with no symptoms or grow aggressively and spread to the rest of the body. Prostatitis, inflammation of the prostate. Prostaturia, abnormal flow of the prostatic fluid discharged through the urethra. Prostate-specific antigen, PSA, or the blood test to screen for prostate cancer. Sperm analysis, SA, or sperm count, testing fresh ejaculated sperm to determine the volume and sperm count, size, shape, and motility of the sperm. Circumcision, the surgical removal of the foreskin. Orchidectomy, surgical removal of one or both of the testicles. Varicocelectomy, the removal of a portion of an enlarged vein to relieve a varicocele. Castration, a surgical removal or destruction of both testicles. Sterilization, any procedure rendering an individual, male or female, incapable of reproduction. Vasectomy, the male sterilization procedure in which a portion of the vas deferens is surgically removed. Vulvovastomy, a procedure to restore fertility. Ablation, the removal or destruction of the function of a body part. Prostatectomy, removal of part or all of the prostate gland. Radical prostatectomy, surgical removal of the entire prostate gland, seminal vesicles, and some other tissues. Transurethral prostatectomy, or transurethral resection of the prostate, or TURP, the removal of all or part of the prostate through the urethra. Radiation therapy, hormone therapy, additional treatments used to control prostate cancer. Male reproductive system. The prefixes and suffixes. The prefixes are hydro, meaning water or fluid. Trans, meaning through, across, or beyond. Retro, meaning backward or behind. The suffixes are ectomy, meaning surgical removal of. Ism, which is the state of. Itis, meaning inflammation. Megaly is an enlargement. Urea, meaning excessive discharge. And pexy, which is the surgical repair of. Word roots and combining forms. Andro means male. Bolano means glans penis or head of the penis. Cryo means cold. Crypto means hidden. Epidemo means epididymis. Genito means genitals or reproductive organs. Gonado means gonads. Orcho, orchio, or orchido means testes and testicles. Phallo means phallus or penis. Prostato means prostate gland. Scroto means scrotum. Spermo means spermatozoan. Spermato, spermatozoa. Testo, testiculo, meaning testes or testicles. Urethro, meaning urethra. Vaso, meaning vessel or duct or vas deferens. Vesico, meaning bladder, and vesiculo, meaning seminal vesicles. Prostatodynia is prostatodynia. Prostatalgia is prostatalgia. BPH, or benign prostatic, equals prostatic hyperplasia, or benign prostatic hyperplasia. Phim and osis equals phimosis. Orc and itis is orchitis. Orchi plus algia is orchialgia. Vas plus ectomy is vasectomy. Balan and itis is balanitis. Balano and plasty is balanoplasty. Balano and rhea is balanorrhea. Circ plus incision is circumcision. Go and nad tropins is gonadotropins.
Types of medical treatment provided by urologists. Disorders and urologist treats. Male and female urinary disorders, male reproductive disorders. Hematuria, condition when red blood cells are present in the urine. Urinary tract infections. UTIs occur when a bacterial infection starts in the urinary tract. Nephrolith or renal calculi. Renal calculi or kidney stones are mineral stones that painfully pass through ureters. Polycystic kidney disease involves formation of cysts in kidneys replacing the normal renal tissue. Patients often progress into renal failure, requiring dialysis or kidney transplantation. Interstitial cystitis, a painful condition caused by inflammation of the bladder wall. Bladder cancer. Bladder cancer most commonly occurs in the lining of the bladder. Kidney cancer. Renal cell carcinoma, the most common type of kidney cancer, occurs when kidney cells grow on the tubule lining in the kidneys. Urethral strictures. Urethral strictures are a narrowing of the ureters, the tube that allows urine to leave the body. Urethral cancer, also known as transitional cell cancer, is a rare cancer that grows in the cell lining of the renal pelvis and ureters. Neurogenic bladder. This urinary problem occurs when the bladder does not empty fully because of a neurologic condition such as Alzheimer's disease, brain or spinal cord tumors, Parkinson's disease, and diabetic neuropathy. Erectile dysfunction. Erectile dysfunction is the persistent inability to maintain an erection to perform sexual intercourse. Male infertility. Male infertility has a variety of causes, including physical, hormonal, lifestyle, and environmental factors. Hypogonadism, or low levels of testosterone, is a condition in which the body doesn't produce enough testosterone or has an impaired ability to produce sperm, or both. Peyronie's disease, induratio penis plastica, IPP, is fibrous scar tissue or plaques inside the penis that causes curved, painful erections. Vasectomy and vasectomy reversal. Vasectomy is a form of male birth control, cutting and sealing the vas deferens that carry sperm. It is an office procedure. Vasectomy reversal is a surgical procedure to reconnect the sperm ducts after previous vasectomy procedure. Scrotal surgery. Conditions in the scrotum that would require surgery include testes cancer, pain or cysts in the epididymis, hydrocele, spermatocele, or varicocele. Adult circumcision. This involves removing the penile foreskin. Common conditions for this surgery: patient preference, difficulty with hygiene, phimosis, narrowing of the foreskin opening, palinitis, inflammation or infection of the foreskin, skin cancers of the foreskin. BPH, enlarged prostate. Benign prostatic hyperplasia causes the prostate gland to press on the urethra, which causes more frequent urination and weak urine stream. Prostate cancer, diagnosed with a blood test screening for the prostate-specific antigen, PSA, and to confirm the disease, a biopsy is necessary. Testicular cancer. Doctors diagnose testicular cancer through blood tests, ultrasound, and biopsy of the testes.